and welcome back to this episode of this Healthy Life podcast. I'm so excited for my guest today. I have Dr. Karen Herbst, and she is an amazing board-certified endocrinologist and one of the leading researchers for lipedema and connective tissue disorders. And she's also the lead author for the United States Care of Lipedema and the head researcher at the Roxbury Institute. So she knows all about lipedema and all these deep research issues that we're going to dive into today to kind of uncover what's really going on. And so, Dr. Herbst, thank you so much for joining today. I'm so excited for you to be on.
Thank you, Erica. It's great to be on with you.
Oh, amazing. Awesome. So I'd love for you to just share a brief intro about yourself and how you got into working in the lipedema space.
Sure. Gosh, I've been interested in fat ever since I was a little kid, and my mom took me shopping, and I saw ladies who had, hanging fat on their upper arm, and I would look at my arm and look at their arm and say, how does that happen? So that kind of stuck with me throughout my life. I also have Ehlers-Danlos hypermobility type, so I have some different connective tissue, and I looked around at other people. Why do what do I have that you don't have, and vice versa? And I finally, after I got a PhD, decided I wanted to go to medical school, and I wanted to work with fat, and endocrinology was the field that I could do that in, but there still wasn't anything for me. So I was in clinic one day. It was a clinic where we help people with their blood fat. And this woman came in and she had Koberling-Dunnigan lipodystrophy. And that is a fat disorder. And I'm like, what is this? And I looked it up and I'm like, oh my God, it's a fat disorder. And she probably thought it was crazy. I was so excited about her. And I was. I dove into it. I learned everything about lipodystrophy I could. I published a number of papers. And from there, I got into multiple symmetric lipomatosis and then Dercum's disease. And there's so many women affected by lipedema that when I opened my clinic to people with fat disorders, they came in droves. And that's when I knew that lipedema was something big and important for women, and I needed to focus on it. And so here we are.
Mm-hmm. Amazing. Yeah, it's like you bring up such a good point. It's not like there's a fat doctor that you go to when you're having issues with your fat or connective tissue, right? You're kind of in this gray area and you're like, I don't know who's the right person to go to. So thankful for people like you, and hopefully that's something that's going to change in the future as well. So we've had a lot of episodes about lipedema. So if new listeners are just kind of chiming in and want to learn what that is, make sure to check out some of the older episodes. But today I really want to deep dive into the connection between mast cell activation and lipedema, which seems to be such an emerging and common thread with so many women that are dealing with lipedema. So we'd love for you to kind of just start by sharing a little bit about what mast cell activation is and how you're seeing that play a role in women with lipedema.
Sure. So I'm not exactly sure what's happening. And I don't want to just put it into a little box and say this is all mast cell activation. Everything is mast cell activation. I'm not sure that's correct. And so this is how I'm thinking about it. There are, lots of different immune cells in your body. There are T cells, there are B cells, there are macrophages or monocytes, and then there's mast cells and others, eosinophils, basophils. And I think in mast cell, what we're calling mast cell activation disease, either there's too many mast cells, so the numbers are higher. And in fact, that's one of the ways to diagnose mast cell activation disease or syndrome is by doing a biopsy and counting how many there are in a high-powered field. So for me, I think, okay, you either have mast cells that are overactive, they're just super sensitive, and they're spewing out their contents when they really shouldn't be doing that, or there's just so many of them that when they do get activated, there's a lot more of their mediators in the environment. So I'm not sure which one is truer or if they're both true. And then there's some ideas floating around that suggest that not only are your mast cells elevated in number or overactive, but so are the rest of your cells in your body. So there's something that causes these cells to stick around longer in the body than they should. But we talk mostly about mast cells because they secrete 1,000 different mediators. So if you're going to see something on your body like a rash or eczema, or you get a lot of itching or flushing, or you have a lot of GI issues, then those are the mast cells, but it doesn't mean that the other cells in your body aren't also present in higher numbers or aren't also overactive and maybe turning on those mast cells. So this could all be kind of a global immune system problem in lipedema. It's just that the mast cells are
The one's getting the most press, right?
they're getting the most press, yeah. And Phil Scherer from UT Southwestern, he discovered adiponectin, which is dysregulated in lipedema, and he came up with a theory that in women with lipedema, their immune systems get activated, from something, and he said probably from the gut. So gut issues start the whole thing, and then those immune cells stay around for a longer period of time and are just at a little bit higher level, and other parts of the immune system are downregulated. So, and I think that kind of makes sense because there's this battle in the literature right now. Is lipedema an inflammatory disease or not? And there's some people that say it is, and there's some that say it isn't. I think it matters what they're looking at, because if you look at only a specific part of inflammation, let's call it inflammation A, it could be downregulated, but inflammation B is upregulated. But they're looking at B and they're looking at A, and they're actually looking at kind of two different things, and they should come
Mhm.
together. So, I really began to realize that mast cell played an important role in lipedema when I saw these small women, very small women with lipedema coming in, who had small nodules all over their body, on their legs, on their arms, on their abdomen, on their hips, on their butt. It was everywhere. And I thought, gosh, what the heck is this? And from recent work out of Professor Cinti's lab in Italy, he looked by electron microscopy at blood vessels in women with lipedema, and they are ripped apart. They are very damaged. And what cells sit around blood vessels? Mast cells. So I do think that they play a role in lipedema. I'm just not sure that we understand exactly why they're there. And it could be maybe that just women with lipedema have more blood vessels, so we have more mast cells. It could be that there is damage to blood vessels, and mast cells come in and help take care of the problem, because they're like army men on the front line, right? So they're under the skin, they're in lining the gut, they line the blood vessels, they protect our body from invaders.
Okay. Lots to research there still, huh? Hopefully one day we'll have an answer to all of it and
I
see what
hope so.
exactly the cause is. And then so there's not really like a test that someone can do, right? So if they suspect like or they know what they have lipedema and they're like, what might be driving this? Like, is it mast cells? Is that something else that I
Mhm.
have to kind of unpack for myself? Is there any sort of testing or markers that you recommend that can kind of point to that? Or is it more just based on a clinical diagnosis and like you mentioned, having some of those mast cell activation symptoms?
So I think you could go one of two ways. If you have enough of the symptoms, then an allergist immunologist could take a look at you and go, you know what, I think you really have this. Let's just go ahead and treat you because of XYZ. And I think that's legitimate because you want to get your inflammation under control as fast as you can. The other way is to do testing for it, lab testing, and you can also do allergy testing. So if you have a lot of allergies, you have a lot of medication sensitivities, that's really kind of a sign that you might have some mast cell issues. But there are some blood tests that you can do and some urine tests. So the blood tests include histamine, tryptase, um, prostaglandins, and leukotrienes. And then in the urine, it's N-methylhistamine, which is a metabolic product of histamine, which I think is actually a better test than blood histamine because you're collecting for 24 hours. And then also in the urine are prostaglandins and leukotrienes. And there's a couple other things like factor eight could be one, and just a couple other tests that I tend not to use. So we have collected, I would say, like 19 women with lipedema who have tested positive by blood or urine for activated mast cells or more mast cells than they should have. And so now we're going back into the charts and we're going to look and see how many we actually tested to get those 19. So if we tested 100 women and only 19 came up positive, then one of two things. Either mast cells really aren't a big deal in lipedema, they affect a small number of women, or two, it's really hard to test for mast cell issues. And I think the latter could be true. And so what I ask women to do, if you're going to get tested, I say do something that's going to kind of activate your mast cells. And I hate to say that. It's like do something that'll make your lipid
Make you feel bad.
yeah, make you feel bad, make your lipedema worse. But it's something like,
Yes.
drinking a glass of wine could do it.
Mhm.
Some have to take their cat and mush it on their face or walk across a grassy field, but a lot of them do it.
Mhm.
And there's a published way of doing it, and that is that you and I show this in my clinic that you can grip around your arm. So you're going to get your blood drawn, and you grip around your arm, and you can feel if you do that your blood vessels um, kind of filling up in your arm, and it feels pressure all the way down to your fingertips, and that's what you want, because if your blood vessels widen, your mast cells go, oh, what's going on here, and they activate, and you just keep holding it, and then when they say, do you have a preference, left or right arm, and you say my left arm, and then they put, they wrap the rubber around it to do the same exact thing, and so you've been doing that for 10 minutes.
Mhm. Mhm. Okay. And then, so what sort of symptoms do women experience if they are having mast cell activation? So I know you mentioned maybe kind of having eczema and rashes, but I think
Mhm.
there's so many more symptoms
There's
that happen from mast
so
cells,
many
right? And
more.
like aren't even really like kind of allergic related types of symptoms, right? It can be anything from like brain fog or fatigue or anxiety and things like that. But what are some common
Mhm.
symptoms that you're seeing in women with lipedema that are
Mhm.
potentially having this mast cell activation?
Yeah, so flushing. And so if you turn, when you're embarrassed, you turn bright red or you're just red and kind of modeling red on the neck. If you have a lot of itching, and some women say when they get on the whole body vibration plate, their legs feel really itchy. Well, yeah, then you probably have some venous disease, and where are mast cells going to hang out? By your veins. So that's another. It doesn't mean you have mast cell activation or you have too many mast cells. It just means in your body, your mast cells can get activated by your veins. So itching, flushing, um, the rashes we talked about, the eczema we talked about, GI issues, just stomach upset when you eat food, or certain kinds of food. Migraines are another sign. Lichen planus, which happens inside of your mucous membranes, above and below. Um, Gosh, now I'm kind of blanking. There's like 2 pages.
So many.
There's so
Yeah, it's
many.
such
Yeah,
a long
yeah,
list.
but those are
And
my
everyone presents so differently too, right?
they do, but those are
Yeah.
my favorites because that really, when you're limited on time and you've got to check for all these comorbidities, if you meet any of those, or if I see somebody who has like 7 medications that they have allergies to or sensitivity to, I'm like, oh yeah, there it is. That's probably mast cell, and I'll make sure I really focus on that. Or if I say, do you think you have mast cell issues? The women who come into my clinic are so savvy. They know. They're like, yes. And these are the reasons why. And I say, well, do you think you could go off your antihistamines to get tested? Like how many days? I say, a week. I mean, at least 4 days, but a whole week would be great. They're like, no, that's somebody who definitely has mast cell issues if they can't go off for a week.
Yeah,
But like
absolutely. And so, oh,
congestion,
go
like
ahead.
your typical allergy,
Hmm.
your itchy eyes, your congestion, like a chronic bronchitis, a history of pneumonia, just all the upper respiratory things that go along with kind of allergies. Having your sinuses, having sinus surgery, just having a lot of sinus issues in general.
Yeah, absolutely. And so you mentioned antihistamine.
Mm-hmm.
So that's one of the approaches. So if you are dealing with mast cell activation, for lipedema or for whatever reason, your immune system is kind of taking this out on you. What are some of the things that you can do to kind of manage the mast cell? So you mentioned antihistamines,
Mm-hmm.
but what other kind of tools are there for your toolkit to try to just kind of stabilize them a little bit and get them from overreacting in your body?
So I think you can go one of two ways. You could go natural antihistamines. So, for example, quercetin is a natural antihistamine, pycnogenol is a natural antihistamine. Diazomin from the rind of citrus fruit also helps with mast cell. And then you can you can take a histamine 1 receptor blocker, which are your Zyrtec, Allegra, Claritin, and then also take a histamine 2 receptor blocker, which is your famotidine, which is used for reflux or heartburn or GERD. But those are the two. You have to block both histamine receptors. So I think famotidine is not often used, but should be used more often. And then one of my favorites is dextroamphetamine. And I know it's an amphetamine, and doctors really don't like to prescribe amphetamines, but it is a mast cell stabilizer. And so if a mast cell encounters something in its environment and it's excitable, it'll excrete its contents. But if you have a mast cell stabilizer like dextroamphetamine, it'll quiet them down and they're not going to
Hmm.
over respond as much. And I,
Interesting.
like everyone's microdosing GLP-1s, I
Hmm.
like to microdose dextroamphetamine and just keep it low to really treat the mast cells and just to improve lymphatic pumping.
Hmm.
And then, of course, GLP-1s are, I think,
Hmm.
very good anti-inflammatories, and I think they work for mast cells as well.
Yeah, absolutely.
And then,
Yeah, I've just noticed in my own journey, right? Just adding in microdosing the GLP-1 was just such a game changer, just in inflammation and swelling, and just so many things improved just from microdosing it. And it's been
mhm.
been pretty incredible. And I'm just excited for there to be more research around that, right? Like everyone's just using it for weight loss, but it has all these other uses and so anti-inflammatory and probably more things that we don't even know it's helping to regulate just yet.
Yep, I agree 100%. I think it's our
Yeah.
best non-surgical tool to
Hmm.
date.
Yep.
hmm And
Absolutely.
there's one report in the literature suggesting that it improved mastocytosis in a patient. And then there's some research studies going on now using GLP-1s for lymphedema, not
Mm.
lipedema, but lymphedema.
Hmm. Yeah, I can see it helping. Like for me, it helped tremendously with swelling, right? And so
hmm
if it can just help your lymphatics drain a little bit better and work a little bit better, we'll see what
hmm
else it can help
But
with.
what is it? Like, what is it
I don't
helping?
know.
That's the thing of,
We need you to figure that out. This
I'm
is your role.
trying, I'm trying.
And so let's talk a little bit about inflammation. So you mentioned there's different types of inflammation, right? That
hmm
you feel like maybe people aren't kind of tracking this to different kinds at the same time to see where these things are causing issues and helping. Are there certain inflammatory markers, say like CRP or TGF beta and things like that, that you can use to kind of track your like inflammation with lipedema, or are
hmm
there specific inflammation markers to lipedema? I guess is what I'm asking.
Yeah, so far there are no particular inflammation markers for lipedema. So, and I've run a lot. If I check for mast cell, I check TGF beta 1, like you mentioned, TNF alpha if I can, um, and make sure I get those prostaglandins and leukotrienes because those are things that are not often measured. But so we did a study and we looked at just regular cytokine markers like TNF alpha, TGF beta, and compared those to controls. And I personally examined every control, so I know that they did not have lipedema. And there was no difference in those inflammatory mediators in the blood. So there's something else going on. And what it looks like, in that study, we did proteomics and we also looked at RNA expression, and it looks like something's going on with the mitochondria. So the body's making a lot more mitochondria. So is it making more mitochondria because it's just growing a lot more fat cells, which don't have a lot of mitochondria? Or is it making more mitochondria because the mitochondria is not effective? And mitochondria detox you, and that's what we need. And so what the proteomics and RNA-seq showed was that there were more reactive oxygen species. Let's just keep it simple and say that. And that's what mitochondria fight against. And there's another study out of Germany showing that reactive oxygen species were elevated in lipedema. And you cannot measure reactive oxygen species in the clinic. It is a research tool. So maybe that's what we're missing, and we should be focusing on the mitochondria and treating the mitochondria. And I've been doing that for a really long time, just kind of looking around like, I'm not sure why I'm doing this, but it sure kind of seems to make sense. And the treatment for mitochondria that I use are to give it the building blocks it needs. So you want to give them B vitamins, but you want to make sure you know your MTHFR gene status, so whether you need to take methylated B vitamins or not. And then you want a good coenzyme Q10, like a ubiquinol. And then you want to wake up the mitochondria and make them work again, make them work effectively again. And I use nicotinamide riboside for that. And that also is a B vitamin, but it's not, and it's been quoted as B3, but it's not. So you can't get it in a B complex. You have to go to, you have to actually buy the nicotinamide riboside. But that is, I think that in connective tissue diseases, in mast cell, in lipedema, that the mitochondria are struggling and we need to support them and wake them up. And in all models, all animal models that they've looked at, obesity, diabetes, where there's a lot of inflammation, there's a lot of adipose tissue, the mitochondria do get woken up by the nicotinamide riboside. And basically what the nicotinamide riboside does is a precursor for NAD and NADH. So you could take NAD, and a lot of people do, and I think that's probably good too, but you're actually taking the molecule rather than taking the precursor that wakes the mitochondria up.
To teach your mitochondria to make it.
Yes,
Yes,
yes.
that makes sense.
And it
Okay.
helps
I've been doing NAD and I love it. So now I'm interested in maybe
adding
trying
on
the
a little.
precursor instead. Yeah,
Yeah.
or doing them both.
Yeah, we're doing them both. Yeah.
Yeah.
And we don't know, there's you can get like NAD, you can get 4x NAD. I mean, so which one is best? And I think you just have to listen to your body. And if you're like, well, that NAD didn't help me, well, maybe you need to add on nicotinamide riboside, or maybe you need to add more NAD. But I think we do need to focus on the mitochondria because that's what the literature is now telling us, that that's the part of inflammation that we've been missing all along. And we need to look closer into the mitochondria and find out what the defects are.
Mm-hmm, mm-hmm. Do you think there's any connection to this issue with mitochondria causing lipedema or causing like more fibrosis to grow? Or is it more just about an inflammation trigger that you're seeing?
That's a really great question. So the things that reduce down mitochondria are inflammation, too much adipose tissue, and aging also. So, like lipedema can get worse over time. So it's kind of a chicken and the egg thing at this point. And looking at mitochondrial function can be difficult. It's you have to look at respiration and if you get mitochondria, you want to get them out of muscle biopsies, and so it's not as easy as we think to test for it. But I don't know which comes first, the lipedema or the mitochondrial dysfunction. But I do think,
Maybe all at once.
yeah, I do think it's there, and I think we ought to,
Yeah.
I think we ought to be talking about it more.
Mm-hmm. Absolutely. And then you had mentioned the gut as a potential source of kind of setting things off or setting off this inflammation that starts
Mhm.
and then progressively leads to having issues with lipedema and mast cells. Can you talk a little bit more about that connection and what you're seeing the connection to the gut being?
So, um, we know that mast cells live in the gut. And so if your mast cells are overactive, they're going to generate a lot of inflammation in the gut, especially when you eat and blood flow starts flowing into the stomach. That's when the mast cells wake up. So we can just say, you know, straight out that if you have overactive mast cells or too many, that your gut will be involved. And what happens when that gut lining breaks down is you get pieces of bacteria into your body. And one of those is called lipopolysaccharide, or LPS. And that comes from the wall of the bacteria. When that gets in your body, that's a huge trigger. And your inflammation gets activated. And one of the ways it gets activated is through these enzymes called matrix metalloproteinases. And they're all around your body. They line your blood vessels. So when a blood vessel in the gut gets activated, it's like firecrackers that just goes and spreads throughout the entire body. Then your whole body's inflamed. And I think some people who have mast cell issues, when they get inflamed, they can feel something entering their body. And I think that's what it is. The barrier, the gut barrier is breaking down, and you have what's called a leaky gut. And I worked with this professor at University of California, San Diego, called Geert Schmid Schoenbein, and he came up with this cleavage hypothesis. So those MMPs, when they run rampant, anything hanging off the cell can get cut off by these enzymes, and that's the cleavage. So that includes your insulin receptors, so you become more insulin resistant. That includes your thyroid hormone receptors, so you develop kind of a thyroid resistance, and your leptin, so your body doesn't know how much fat it has, and on and on. So all those receptors. So the communication with your cells is less good. It's poor. And your hormones aren't working quite as well. And not necessarily your sex hormones, because those don't need to, the receptors are actually are intracellular. So it's probably not those, but thyroid, you ask how many women with lipedema have thyroid disease? A lot, right?
Yeah,
And
absolutely.
how many women
And leptin too. Like that's a marker that, before I even found out that I had lipedema, it was a marker that was always high. And I was just like, how is this high? And I don't feel like I have like leptin resistance symptoms. Like I was like starving myself because I was like struggling so much with lipedema. And I did HCG 10 times. I had no problem skipping meals and food and not eating, but I was just like, how is this so high? How will it not come down? And it's interesting that it's all kind of tied into this, and makes so much sense that it's tied into gut inflammation as well.
hmm And so I think another, marker of inflammation you can follow is if you're not on thyroid hormone and you don't have TPO antibodies suggesting autoimmune disease, but your TSH is always high, you're inflamed. You're cutting off your receptors. Your MMPs are elevated. And so that's another part of inflammation that we're not looking at, because I know in, the study where we looked at cytokines, MMPs are not considered to be cytokines. And if you have a gene variant, for example, in an MMP, so that your MMPs are activated more often, you're going to be inflamed all the time, right? And then your body will try and fix that by lowering certain parts of inflammation. So here your MMPs are elevated, but like your complement proteins are all down regulated. And so we look for inflammation and we're like, look, there's no inflammation, but we didn't look at the MMPs. And those are all coming from this, mast cell issues in the gut, or, food sensitivities in the gut, or slow gut motility. If you're not digesting your food and you have a connective tissue issue and your food sitting in your gut and rotting over time, that generates inflammation. So taking digestive enzymes with foods that are hard to digest, like meats or fats, especially
Mhm.
anytime you eat a
And that's gonna
fatty
that's gonna
meal.
be hard with GLP-1s helping too, right? Because it's like the GLP-1s are helping, but they're also slowing down your gut motility even more. So it's like
Yep.
finding that balance there.
And then you take some enzymes to digest your food, and then you get reflux, right? You get GERD. Nothing is easy. And I think what one thing that the GLP-1s have taught us is the microdosing. And I think when you are taking other things, like you shouldn't take a handful of enzymes, you should take a very small amount of enzyme to start, because you don't want those enzymes coming up your esophagus and causing damage, which you're going to feel as heartburn.
Mhm. And then in your kind of work with patients and your own research as well, have you found that there's other sorts of triggers for this inflammation? So say like SIRS is like chronic inflammatory response syndrome from like biotoxins like mold and things like that,
hmm
right? Or infections like Lyme that are highly inflammatory, or even COVID now, which is also a super inflammatory condition that can kind of wreak havoc on you for a while. Are you seeing that there's other infections or environmental factors that are contributing to inflammation that's
hmm
then leading to lipedema, or kind of, setting it on fire, or are you
hmm
seeing it more purely gut and mast cell kind of
No,
range of
I
things?
think that, when anyone comes in, you have to throw a wide net, because everyone is different. So I think vein disease is a huge source of inflammation that we don't consider. And there's really no good treatment for vein disease, except, they close them down. That seems to help. They close them down, but over time, the pressure of fluid in the leg goes somewhere, so it widens another vein. So they close that down. So it's like whack-a-mole. Veins are like whack-a-mole, and we're not treating the kind of vein disease that I think women with lipedema have, which is the small vein disease. And I think that compartment syndrome, where you grow fat around your vein and you squeegee the blood down and then it flows back out to the skin. So it's a reflux. But when you look at the vein isn't refluxing because all this fat is growing around it. It's just coming out where it started from. And so those small veins are dilating in the up near the skin and pouring fluid in and damaging that superficial fascia. So when fat grows, there's nothing holding it in. So I think inflammation in the veins is huge. And there's a Swiss study that just came out showing that about 86.2% of women with lipedema have vein disease, some kind of chronic vein disease. So I think we always have to consider that. We always consider mast cell, like, do you have mast cell? Do you have vein disease? And then I do think that infection is very important, and autoimmune disease, because if your body is set up to generate autoimmune disease, that is inflammation. That's part of the inflammatory pathway. So anyone who's got Hashimoto's, that's a sign. Oh my gosh, you're set up for autoimmune disease. You're set up for inflammation. But we don't understand why that happens. And or someone has vitiligo. So Hashimoto's, vitiligo. What are some other common autoimmune diseases? Type 1 diabetes. Any of those, that tells us that you have autoimmune induced lipedema inflammation. So getting all the inflammation down that you can is important. And I think identifying it is important, even if you're taking a GLP-1, because I don't think the GLP-1s treat all of inflammation. And for a lot of women who have vein disease, if I see they have a lot of it, using my thermal camera, I just say, you need to start diazomin. You need to get that in your body too. You need a little extra help. That GLP-1 is not quite enough.
Hmm. Yeah, so that's a good point. So what are some symptoms if you're having kind of the vein issues, right? So I mean, obviously we know that it's swelling because they're kind of
Mm-hmm.
leaking out, but what are some other things to look out for to suspect if you are having issues with the veins? Because you mentioned 86% of women
Yeah, with lipedema
are
have
dealing
some.
with it, right?
Yeah,
Yeah.
or more. So we have some
Yeah.
data that we're working on as soon as I finish this other paper, that it's going to be more in the 90s. Yeah. So the thing about vein disease is it overlaps with the same signs and symptoms of lipedema. So achy legs, heavy legs, swelling in the legs, and often women, will show pictures of when they were kids, and they'll show that their calves were already tubular, kind of large. And I had a woman bring in her 11-year-old daughter and said, "Do you think she has lipedema?" And I'm like, I'm not going to diagnose any child, that, but I will look at her with my thermal camera, and sure enough, she had enlarged veins in her calves. So, and you could see that she did have tubular calves. So I said, well, she needs to wear some sports compression to keep, supporting those veins. So achy legs, heavy legs, itchiness when you use whole body vibration, swelling, swelling that gets better after elevation, swelling that gets worse with heat. It's really the same as lipedema.
Mhm. Mhm. Yeah, so much overlap. It's so hard to tell which one is inducing what, right?
Yep. And sometimes women who have those symptoms, I look at their legs and they have no vein issues. But a lot of women with lipedema has spider veins. And I think spider veins can be a marker of underlying small dilated veins. Or they have that livido reticularis. That's another pattern, that lacy pattern on the skin. Or acrocyanosis, where their hands and feet turn red. So they're not regulating their blood vessels very well. So that's a, like an autonomic nervous system dysfunction.
Mhm. Yeah, and that's a good point actually. Just, there's a lot of in the mast cell activation world, I've done a lot of podcast episodes on this and kind of dove deep into this office. And it seems that nervous system regulation is a big piece in kind of managing your mast cells, right? Whether you do that through like that vagus nerve stimulation or DNRS or something similar to that. What's kind of your thought on that? And is that helpful for women with lipedema to do some sort of that nervous system regulation to see if they can calm that mast cell response a little bit?
Yeah, it's kind of like a two-way street. So if your autonomic nervous system symptoms are getting worse, that's a sign that your mast cell issues are worse. So, kind of treating the mast cell a little bit more aggressively during that time period to improve those symptoms is important, and making sure you take in electrolytes to, so that you have enough fluid in your vasculature so you don't start spiraling. But yeah, I think I think one thing that we don't talk about often enough are things like mindfulness is um, being able to calm down your nervous system. And I think I've been looking at vagal nerve stimulators for so long. I just want that inexpensive handheld one that you can just hold up to your vagus nerve whenever you need
Mhm.
to and turn it on. But there are so
Mhm.
many different, you know, ways of using mindfulness to calm down the system that kind of mimics a vagal nerve stimulator.
Mhm. Mhm.
But I
Yeah,
I
absolutely.
think we should I think I should put in my notes mindfulness. Make sure you use mindfulness.
Do something to relax yourself,
Yeah.
right?
Mhm.
And then, so if someone has gone through all their lipedema surgeries, but they're still having issues with mast cells, I think one of the biggest fear that most women probably deal with after they've gone through surgery is it going to grow back? What do I need to do to
Yeah.
make sure that I never go through this again, right? And GLP-1s are a huge tool, I think, for this. Obviously, diet, compression, like lymphatic drainage, like all those things that you kind of probably were already doing pre-surgery, right?
Right.
But how do we need to approach this from a mast cell and inflammation perspective to make sure that we don't find ourselves with more growth after our
Mhm.
surgeries?
Well, I think it's kind of just like what you said. I think even if you don't use GLP-1s before the surgery, if you would consider microdosing them after the surgery, and because you have mast cell issues, I think that's a good idea. I think hyperbaric oxygen therapy is a great way to reduce inflammation and calm down your mast cells after surgery. If you take a certain amount of mast cell stabilizers, you might want to double up on that. Talk to your allergist. How do I double up, or do I add on something that I haven't been using before? And then wean off that after your body calms down. I think there's a whole bunch of different strategies that can be used. And the problem with mast cell is every time you try something new, you could react to it. So, and there's
Right? It's a slippery slope to test things out, isn't
It
it?
is. So it might be a good idea to get a little GLP-1 and try it before the surgery to make sure you're not going to react to it, because that would be terrible if we made things worse for you after. And there's some women that do not tolerate GLP-1s. So they're not that many, but if you're one of them, then it's 100%. And we don't want it to be you. And you have to have good providers who are willing to give you a tiny bit of amphetamine. And you have to make sure that you understand the natural antihistamines that are out there. Like I use quercetin and I put it in a shaker, and I put it on all my food. So you're just adding a little bit all the time. If you like react to foods like, on the FODMAP, list, there's a new enzyme out called FODzyme. You could put that on your food just to make sure that whatever you eat, you're not going to react to if you have to go out to eat, for one reason or another. I think there's a large number of things to do, and I think you should plan it before you have your surgery so you're ready after your surgery. And it's going to be different for everybody. If somebody has really bad gastric motility, they're not going to be able to use a GLP-1. So they're going to have to use other things. And if they have mast cell issues, they kind of know what they are. And if you read any of Larry Afrin's books, he lists all of those things that you could use. So that would be a good book to get to it has the word Occam in it. Depend on Occam or something like that. But Larry Afrin, AFRN, he's kind of my mast cell guru that I go to.
Hmm. Awesome. And then, so I just want to dig in a little bit deeper. You mentioned hyperbarics are really helpful for mast cell. Can you share a little bit more about that and how that supports it?
So hyperbaric oxygen therapy is very healing. Like and it's usually used for people who have open wounds that just are not healing over time, and it saturates the tissue with oxygen, and the cells just love it, and it's like crack for them, and they heal, and it induces the growth of new blood vessels. And I think we think about lipedema and we say, oh, the lymphatic system, so important, so important, so important. But what we don't realize is that the blood vessels are falling apart and shredding. And that means you're not getting healing blood into the tissue. So that high pressure forces blood into the tissue, and then that high oxygen gives those cells what they've been lacking, and they can start to heal. So your mast cells are going to be activated by bad blood vessels in the environment. So if you start healing those blood vessels, you're going to calm down the mast cells. And it's just hyperbaric oxygen therapy is very well known to be anti-inflammatory. It's just expensive, and it's not something you would do like in your, on a daily basis, I don't think, because, it is kind of dangerous, and it, requires some expertise, but you can pay for it. Um, After your surgery. And I think if I knew that I generated a lot of inflammation, um, with, minor things, like mosquito bites, I think I would probably at least have one session of hyperbaric oxygen therapy. And I think you can do as little as 3 and be done with it. I think, yeah. And to know that, you could do those right after the surgery, where you have your surgery if you're away from home. But then if you're near home, you could, you could have another session if you really felt
Mm-hmm.
like you needed one.
Mm-hmm. Okay, amazing.
Mhm.
Awesome. Well, we have time for one more question. So I want to kind of just look into the future, kind of like what are your thoughts of like where things are going to go with research and, are we going to be digging more into mast cells? Are we going to be digging more into inflammation, or where do you kind of see the direction in
Mhm.
research going with lipedema as we go into the next years?
Yeah, so there is a gene that somebody described, and I've seen it in women with lipedema, not all of them, but I've seen it, and that gene links up estrogen and mast cells. So I do think that that's important. And what that says to me is that there are certain genes that are important specifically for women, and we need to find those genes. And for example, there's a collagen, it's called collagen 11A1, and it is important in degenerative disc disease, but it's also important in scoliosis. So they took men and, girls and boys, men and women who had scoliosis, and it turns out that if a woman has a collagen A1 variant, she gets scoliosis. If a man has it, he doesn't. So
Hmm.
that's an
Aren't we lucky?
Aren't we lucky? And the funny thing is, all the genes that I've looked at, it's always the women gets it and the man doesn't.
I know. It's always seems to be us.
Yeah. So, and that for some reason. So I think that what we're going to start to realize is that, there may be some genetic variants that we're going to find are specific for women. And those are going to give us insight in how women react to medications and women develop disease versus men. So I see that in the next year, like by 2026, we'll probably know one of the genes that they think is important in lipedema, and it's valid. Some of these other genes that have popped up, we're just not sure they're valid, right? And then I think we're going to better understand women in general, and better understanding women is going to help us better understand lipedema.
Yeah, absolutely. Awesome. Well, I'm excited for all the future and what we're going to find out about this very unknown, understudied disease, right? That doesn't
Yes,
even have a true doctor that even treats it. So it's
correct.
a lot of progress that needs to be made in this realm. So excited for
Absolutely.
that to happen. Awesome. Well, Dr. Herbst, thank you so much for sharing all this amazing information. If people want to find you online, what's the best way to find you?
I'm at the Roxbury Institute, and so if you just look up the Roxbury Institute and our lipedema treatment program, you'll find me there. Or you just put my name on your search engine, and I pop up. And I'd be
Yes, you
happy to
do.
see you.
Amazing.
Anybody.
Thank you so
You're
much.
welcome.
Aw, I appreciate you. And we'll link to everything in the show notes as well. So thank you so much.
Thank you. Take care.
You too.
Bye bye.